Good afternoon, everybody. Thanks for joining us. We're here today with Patricia Prewitt. She is the expert on how to potentially pay less in prescription medications. So I'm not going to talk too much on this. We'll let her get going here. And if you could keep your videos off, we are recording this and we will answer questions at the end. So feel free to type any questions you have in the chat box and we'll be sure to get to them. Okay.
Okay, are we ready to share my screen?
We're ready.
Okay, let's hope. Oops. This is where I'm opening my window. Here we go. All right. So, are you guys seeing full screen?
Yeah.
Okay, great. So hi, everybody. Welcome to coming and attending Strategies for Saving Money on Prescriptions. Shout out to Rick and the team at Financial Planning Solutions for hosting me at this event. And without further ado, I'm going to go ahead and get going. Just a little bit about myself. My name is Patricia Prewitt. I go by Tricia. I spent my career in the pharmaceutical industry in a number of roles, primarily sales, marketing, product management, managed care, and training. I have now started my own business, which has a consumer education focus, and I work with people individually as well as small businesses and do private consulting. This is my disclaimer that I need to read, which is this class and its related materials are for educational and informational purposes only. It is not intended as a substitute for advice from a qualified medical professional. The views and opinions expressed here are those of the author, which is myself, and are certainly not intended to serve as a diagnosis, treatment, or prevention of disease. And I've also added here that prescription programs and offers are constantly changing, so savings cannot ever be guaranteed. These are the goals that I have put together for the webinar. My primary goal with education to individuals is to demystify how these various prescription savings programs work. And at the end of this webinar, I hope that you will have an idea how you can choose which program that might work for you. I'm going to provide some take-home ideas and also a safe space to ask questions. I do know that Rick has asked for your photos to be not showing. So anyway, here's the webinar agenda. I do need to spend just a little bit of time talking about the different prescription channels because that is how the industry looks at their world. So a little bit about definitions and terms. However, most of the time is going to be spent on basic savings tactics, including practical tips with time for questions. When I talk about the different channels, this is how the industry, the pharmaceutical industry, looks at the different channels. And as you're looking at this bar graph, I just want you to think about where you fall in this particular drug channel. The first and still the largest is what I would call traditional insurance. It is insurance that you probably receive through your employer or through a commercial plan when you are working, and that makes up about 54% of the market. The next biggest bucket are those of us that fall into Medicare plans that are government plans, about 18%. Medicaid, and I'm in Massachusetts. I know not everyone logging on is in Massachusetts, but we call that Mass Health here in Massachusetts. That makes up close to 18% of the Medicare. Then we also have direct purchase, or what I'm calling Obamacare, which is at about 11%. And then about 4.5% of folks fall into the TRICARE bucket. Now, what you'll notice is that government plans are now making up close to 50% of the market. Now, getting into the basic ways to save. There really are 4 different avenues, and that's what I'll be talking about today. The first avenue is how do we save on brand name expensive medications? And that is with something called copay cards that you'll see with the little red asterisk are not generally allowed for government programs. So next, we'll talk about how to save on generic drugs, which is getting exceedingly more expensive for a lot of us on a lot of the plans. And that will be addressed with savings cards. The third avenue that I will spend some time with is the direct to consumer avenue, primarily with cost plus drugs that was started by Mark Cuban back in 2022 as a disruptor to the pharmaceutical market. And additionally, interesting, some pharmaceutical companies are now actually selling direct to patients and skipping using pharmacy benefits plans. The fourth way that I will talk about is for patient assistance or government programs that are for expensive brands. And I believe some people are often surprised to find how generous some of these programs can be. First up, what is an expensive brand name drug? Most of us, I think, know what this is. They are products that are advertised on television, on the radio, in print advertising, internet ads, streaming, YouTube, Facebook, probably on TikTok. I'm not on TikTok, but probably on TikTok. So anytime you see an advertisement for a brand name medication, your brain should automatically click in and say, that's an expensive drug, because advertising is not cheap. When you see these things, you may also hear of or see on TV or see on streaming some language that says, oh, you could only pay $5 for that, or $10 for that, or $20 or $50. Well, how does that work? That works by accessing something called copay savings cards that are offered by the branded medications, by the pharmaceutical companies to help you save if you have traditional commercial insurance. If you're in that bucket that I showed earlier of about 55% of Americans fall into that bucket. In very tiny type, or at the end of the advertisement, you may hear something called, what if I can't afford this medication? Well, maybe a patient assistance program can help. And we'll address that later on in the webinar. Now, these branded medications, in order to find the savings cards, what you do is you go to the manufacturer's website and you would search savings. How do I save? With digital, it is now easy and very possible to print or download that savings card right to your computer or right to your phone. And you bring that with you to the pharmacy when you pick up your prescription. You go over to the gal who inputs all the information and you request that that be added to your profile. Now, the downside of using a copay card, or really any of these cards and programs, is that there will be marketing and data capture, and the tax rules for how this gets applied to a deductible for your prescription plan is going to vary. Now, when I talk about a branded copay card, follow your eyes over to the little red arrows. These are things that specifically say the name of the drug. In this particular photo, I've had physical copay cards from doctor's offices for products like Linzess, Synthroid, Creon. These are branded name pharmaceuticals, and these are the cards that you're looking for. If they're not in your doctor's offices, you can find them online. How would I find them online? Well, this is a screenshot that I'm sharing of a product called Trelegy. Trelegy is an inhaler. That's used for COPD or for asthma. And the call outs that you'll see here is cautionary tale. Be cognizant when you log on to the web that the very first thing that you see may not, in fact, be the website for the Trelegy inhaler. In this particular case, I think it's showing that it was like 4 or 5 down on the website, on your screen. So just be careful when you're looking for a branded product that you're not being directed somewhere else to maybe a competitor product or to maybe a Canadian pharmacy or who knows where on the website. What you'll look for when you've identified, if you see in the call out for the circle B, is that you will clearly see the name of the product in the header, which tells you that you're on the right website. And then on this particular version, the savings coupon notification appears to the far right of that dropdown. What will happen is when you go to that dropdown for that product that you are looking for specifically for you or someone in your family or someone that you're helping, is you will find the dropdown for a sign up. That's the area C. Yes, it needs your particular email information in order to download and send a savings card to you for your computer or for your phone that allows you to take that to the pharmacy. Now, I'm going to stop here for a minute and give an example of a client that I worked with last year. And here's the situation. This is a client who is a working person, has a family, has a standard commercial plan. He happened to have a high deductible plan for his family. Within the high deductible plan, he had a $5,000 deductible. The way that plan was organized was it included in that deductible his medications. For him, healthy, really very few costs, but he approached me and said, "Hey, Trish," he said, "I've got this cream that's being prescribed for my son, and it's costing me $60 a month because he's going to pay whatever the cost is until he reaches his $5,000 deductible for his family, because that's the way his insurance plan is set up." So his annual cost, $60 for this particular cream for his son, $720. He asked me if I could do anything. I said, "I don't know. Let me take a look." Surprisingly, and I am surprised many times because these programs change a lot, I was able to identify a program called Care Connect that had copay cards for brands for certain dermatological products. By registering for that card, it brought his copay, or it brought his cost, I should say, down to $20 a month because the branded medication picked up and offset $40 a month of that out-of-pocket cost for him. So that right there saved this particular client over $480. And this is a term that I will use in the presentation, the OOP cost, the out-of-pocket cost. And in this particular case, this will likely accrue against his deductible because it is a branded product and he is using a branded product's copay card with his insurance. It's really fascinating. Okay. Secondarily, I'm changing topics. I am going to move to now what are called savings cards. And savings cards, look at the arrow here, are going to look similar to a branded copay card. And let me see, can I go back a little bit? I'm going to go back just a little bit. You see with the red arrows on this Linzess card, I know it's hard to see on the screen, but there are these funny little numbers. They're like bin numbers, code numbers, all this sort of stuff. Those are the magic numbers that your pharmacy tech will use to input and put against your personal file to help offset costs. Now, when we look at something like in this photo, it's WellRx, you see a similar thing. You see an ID, you see a group number, you see a bin number. What you do not see on these savings cards is the name of the product or the prescription that you are looking for. They are general cards. How do we use those? Well, there's lots of different cards out there. The ones that advertise the most, even on radio and TV and in print, are GoodRx, Single Care. There's a company called Needy Meds that's a 501c3 that I like to check because I like that they're a nonprofit. These savings cards are used best for generic medications that for most people cost $15, $20, maybe $30 for a 90-day supply, maybe $60 for a 90-day supply. They're not super expensive. They're not necessarily cheap. Sometimes they are. And sometimes there's a product that's not covered by your insurance. This is the time to actually look for savings cards. How do these work? Well, those codes that are on the card will help your pharmacy determine the pricing for the particular medication that you decide to use a savings card for. The caveat that I put here is, please, everyone, if you're paying $4, if you're on the Walmart list and you're paying $4 for your medication, or you're paying $10 for a 90-day supply, please understand that that's a fabulous price and it's probably not worth doing any kind of research. But here's what happens with savings cards. This is a comparison of exactly the same medication, doxycycline Hyclid, 20 capsules, and I used my particular zip code where I use, which happens to be in Massachusetts. These are all prices checking on doxycycline for 20 capsules. If I decide I don't want to use my insurance, or maybe my insurance doesn't cover this particular drug, even using a savings card is going to vary depending on the pharmacy. It also depends on the zip code. So this is why, as an educated consumer, you would want to choose to do some research before you decide to use a savings card or change a pharmacy or see what things cost. Now, I'm going to go back to that same client. With this particular client, he had a medication that was a branded medication in the first example. Secondarily, he actually had doxycycline, 100 milligram, available generically, also being prescribed for his son, also costing $60 a month for 60 capsules. He's going to pay that $60 a month because the way his plan was set up, he doesn't get any benefit on anything until he hits that $5,000 deductible. Now, in this particular case, I knew that doxycycline is a generic medication. So what I did was started looking at what are the savings cards like? What are some other options for him to use to cover that medication? In our area, what I found was the Shaw's or the Osco pharmacy. If he chose not to use his prescription insurance benefit and instead use the GoodRx copay card or savings card and pay cash, he could pay $18.46 shelled out at the pharmacy instead of paying $60 a month and using his prescription insurance plan, going against his high deductible. Now, I also found, just by doing a little more research, you can see on the slide, the prices using the savings cards vary by pharmacy outlets and vary by which savings card you're choosing to look at. You can see that my findings, clearly the Shaw's was the best price to use for that copay card. I did look at Cost Plus Drugs, which had a $13.46 price for that medication. But in this particular case, the client chose to keep his prescription locally, use the Shaw's savings card, and pay less than $20. Now, this saved the client, nearly $500, right? The downside to this is that this particular prescription is the client is saying, nope, I don't want to use my prescription plan. I'm not going to do it. I would rather hand over $18.46 with this coupon of GoodRx, ignore my insurance plan. The downside to this is that if you or even Cost Plus Drugs or some of these other avenues, you are basically saying, nope, I am not using my insurance because it's less expensive for me not to use my insurance. However, you are not accruing anything towards that deductible because you are not using your insurance. I know it seems crazy. Here's an example, again, of how those cards will vary based on the pharmacy and the medication. So if I can call to your attention here, the little red arrows, when you are doing this research and looking at savings cards, it's important that you literally look at that medication, find the savings card that makes sense for the pharmacy that you want to use, and the card that you will bring in with you is specific for that price for that medication. Now, I'd like to stop here for a minute, and maybe Andrew, you can help in the chat. Based on what we've learned about brand name medications versus generic medications, what do people think Ozempic is? Is it a brand name medication or is it a generic medication? Andrew, I'm not able to see the chat. Are people chatting in at all?
Let's see. We got a generic as an answer in there. Let's see. Brand name from another. So we got a mixed bag.
Got a mixed bag. Okay, so here we go. Oops, let's see. Here we go. Ozempic is actually a brand name medication. It's actually trending because it's one of the new diabetes meds that a lot of the stars in Hollywood and whatnot are using. And it is very useful for patients with diabetes in helping with weight loss. It is a very expensive medication. So if I go and look at using a savings card for Ozempic. On the left-hand side, you'll see that WellCare or WellRx, which is a savings card, they can give that to me for $959 a month. I don't know about you guys, but that seems pretty pricey. If you go to the right-hand side, you will see that Single Care, which is also a savings card, would beat that price a little bit by $822. But if you follow all the way to the right, you will find from NovaCare, who is the brand manufacturer for Ozempic, by going on the Ozempic website for the branded medication, and I don't really expect for you to read this, but if you have private or commercial insurance, you might be able to get that product for $25 a month using your insurance and opting in to use the Ozempic branded copay card. I know copay cards, savings cards, they all kind of sound alike, but if you are taking a brand name medication that usually is going to cost $25, $50, $75, maybe even $100 a month, using your prescription benefit plan, if you have commercial insurance, I would highly, highly, highly recommend that you search the brand name website to see if you can't get a copay card that would, from the manufacturer, that would save you a lot of money and it still accrues against your prescription benefit and your prescription plan. It's pretty awesome. When I was in the business as a pharmaceutical rep, only about 8% of people who had commercial insurance elected to go and try and find these brand manufacturer copay savings cards. That has increased as people become more aware of these options. And that's part of my job here today, is to just help you understand what the different savings options can be. All right. I know I moved along to my new direct-to-consumer, primarily focusing on cost plus drugs, which was founded by Mark Cuban in 2022 with only 100 medications at that time. It is set up as a public benefits company. It is a direct-to-patient option, not using prescription insurance processors, not using your prescription plan. And the website now boasts over 2,300 products. The premise for this is to disrupt the pharmaceutical market, to bring some transparency to consumers who are using the products in terms of pricing. Now, how do you find out if your medication is offered and its price? Well, you need to search the Cost Plus Drugs website to find out if your medication is even offered by its dose, its strength, and its form. And then you would compare that price to what you are actually paying on your prescription insurance plan. Now, how do you use it? Proactively, you need to think about Cost Plus Drugs kind of like Amazon. You need to set up an account in advance. This is a mail order pharmacy, so you need to be prepared if you're going to change and use Cost Plus Drugs instead of your local pharmacy, or even instead of a mail order pharmacy like Express Scripts. And then, so you've got to make sure you've got enough of your medication on hand, because it is mail order and it'll take a little bit of time for processing. Will it work for you? Well, like a lot of things, it depends. If your medication is offered and if your provider is willing to write you a new prescription. I'm kind of in love with the Cost Plus Drugs website. I find it very easy to navigate. It is very clear. You can see on this screenshot, this is amlodipine, which is a product that I find a lot of people use, and the pricing is all over the place. I've just seen lots of different pricing for this particular product, which is why I picked it as an example for this webinar. This is a 90-day supply for $6.80 from Cost Plus Drugs. Now, they're not showing you the $5 shipping fee on here, which so you arguably it becomes $11.80. But still, if amlodipine is $35 or $40 or $50 for your 90-day supply from your current pharmacy, you might want to change pharmacies and get a new prescription and start getting your prescriptions from Cost Plus Drugs. I had a client that I worked with who every single one of his products that he took was available on Cost Plus Drugs. So by changing all of his prescription, and he had a high deductible plan. So he said, I'd rather use that high deductible for my medical costs versus my prescription costs, have that available for, for his doctor visits and whatnot. So this is a woman that I worked with again last year. This happened to be, and again, this is an example of how a Cost Plus Drugs or a savings card can work with a Medicare patient. This was a Medicare Part D client. She had many medications that she was taking, but one was what I would call a high cost covered generic medication. Her plan covered it, but it was Celebrex 200 milligrams. It was at a tier 4, which is a pretty high tier, and required a 50% cost share in order to use her prescription plan. In this particular case, the client was the adult daughter who had asked me to look at her mom's prescriptions, and her mom lived out of state. The current out-of-pocket cost for that medication using her Medicare Part D plan, insurance plan, was $182 a month. So we found a 90-day supply for $9.50 using Cost Plus Drugs. We also found a GoodRx coupon for that exact same medication, 90-day supply at Walmart for $21.73. So the client's option was to really save a lot of money and open an account at Cost Plus Drugs. And she would have needed to get a new prescription from her provider in order to do that. And working with the daughter and the mom determined that it was going to be easier for her if she used the savings card with cash at Walmart, which happened to be her existing pharmacy. So this is just an example about how doing some research to find and compare your prices can really truly save a boatload of money. Okay, last but not least, patient assistance programs. These are programs, when I talk about patient assistance programs in my world, I am talking about the programs that are offered from the brand name big pharmaceutical manufacturers. There are some programs through the federal and state government called Extra Help that are for very low income seniors. But what I'm talking about here are for the rest of us, those of us who are working, but we might not be making a ton of money. For those of us in the strongly middle class. And just to let you know, these patient assistance programs are not just for seniors. So these are programs that are offered by the brand name pharmaceutical companies for products to allow access to people who might not otherwise be able to afford them, even if they have insurance. Now, these programs vary and they have income limits. The other thing about patient assistance programs is that your physician's office is always involved. If you are approved for a patient assistance program for a high cost medication, typically somewhere between a 3 and 12-month supply will be sent to your home free of charge. Patients with Medicare can qualify. Patients with traditional insurance commercial plans can qualify. How do you find out about these things? Well, again, we go to the manufacturer's website. Sometimes there is a company foundation that will tell you about the product. You can also Google. They're not always easy to find. Sometimes they're a little bit buried. What I want people to see here is that the prescription assistance program, do look at income. Many of the companies that are pharmaceutical companies use either 300% of federal poverty level per household, 400% of FPL, federal poverty level, or 500%. And you can see that it's also categorized on this grid. This is for 2025, depending on how many people are in the household. Now, if I'm a one person and that pharmaceutical company uses 500% of federal poverty level, that means that I could qualify for patient assistance as long as I make under $78,250 a year. This is why some of these programs can be quite generous based on income limits. All right. How do we find these programs? I'm picking on a product called Eliquis. Eliquis is used by quite a number of people. It is currently a brand name product. It typically costs Medicare patients $47 a month. But how would I find patient assistance? Let's say I really can't afford that $47 a month, even on my insurance plan. So you go to your friend Google and you start typing in things like this to see if you can find help. Now, once you are on the actual website for Eliquis, for the brand name manufacturer, make sure you're not being diverted to somewhere else. This slide actually shows you two different things. With the red arrow on the left, you can see that if you are a working person with commercial insurance, guess what? They've got a copay card. So if you're paying $50 using your prescription insurance, why wouldn't you sign up for the copay card and pay maybe $10 instead of whatever you're paying on your prescription plan and let the pharmaceutical company pick up the rest? Yes, you do have to give up your information. You will be getting probably marketing things that say, here's how you take your Eliquis. And by giving up your email, they're going to send you that copay card that you will then use with your insurance to pick up your prescription the next time. Now, if you're on a government plan or Medicare Part D, you can't use that copay card because the rules are such that you can't, but you might qualify for patient assistance. And in this particular case, I do know that Eliquis has a patient assistance program. However, they use that 300% of poverty level as income guidelines, which in this case, I'm going to go back, would be you'd need to be making under $46,950 to qualify for the Eliquis patient assistance. And they also have a little caveat that says you also must be paying at least 3% of that income for all of your medications out of pocket. So there's little quirky rules about these programs, but they do exist. And if you qualify, I would argue that they're very beneficial to your financial bottom line. In order to sign up for these patient assistance programs, you need to have the office staff involved. They will ask for either tax returns or allow for digital confirmation of your income. And I always tell people to save everything, have patience, and be kind but persistent. Is it worth it? In my view, absolutely. If I'm paying a lot of money out of pocket and I can qualify for that patient assistance program, and get medications at no cost, why wouldn't I do that? Everybody has different financial situations, but just be aware that every program and even every brand has different guidelines and rules. So where do you start? Well, first of all, you make a list of your out-of-pocket costs and you start with the big ones. Again, if you're paying $4 or $10, I would say don't bother. But if you've got a lot of Medicaid, if you've got high-cost brands, you would look at that branded copay card. If you walk away with anything today, I hope you understand the difference between a high-cost brand and a branded copay card versus using a card like GoodRx or Single Care, which can really help you with generics, but not really for those branded products. If you qualify for patient assistance, like check the income guidelines. For Medicare people, if you're paying $27 to $47 a month for a branded product, I'm here to tell you that's probably about as good as you're going to do unless you can qualify for their patient assistance. If you don't have coverage on your plan, that drug is not covered at all, check the savings cards. Go to GoodRx, go to Single Care, go to Needy Meds, type in that drug name and see if there's savings. If you've got a high cost generic or a lot of medications, check your savings cards, check cost plus drugs. And again, if you're paying $4 to $10, just please be happy. Practical advice. Know which bucket you fall into because that will affect which programs will work for you. Make a list of all of your medications and know what you're paying out of pocket. I always recommend knowing if medications, can some of them be eliminated? Sometimes physicians just renew and renew and renew, and maybe you've lost 20 pounds and you don't need that other medication now, or you've stopped smoking and so your coughing is better. Always check to make sure that you need all of those medications that you do take. Work from your high cost and work logically down. That is my website. And then this is my information if you wanted to reach out, or if you want to look at ordering the digital guide, which I have a 12-page guide that walks through these steps along with the worksheets on my website. And I do those free 10-minute consults. So that's my information. I think I'm going to go ahead and stop sharing and see if we've got questions.
We've got questions.
Okay.
So you've got answers. I'm going to go through them one by one.
Okay.
There's a bunch that came through directly to me as well, so we'll get those after.
Okay.
The one question was, let's see here. Get back to the top here.
I'm going to keep my slides up in case I need to go back. Is that okay? Okay.
So one question was, as far as savings cards, do you need to present just one, and will it apply to all medications?
So this is a very good question. Are my slides gone? Can I go backwards here? So I actually had the privilege of having a pharmacist attend one of my programs that I did at a senior center. And think about it from the pharmacy standpoint. If you show up with just a GoodRx card, like that you can pick up anywhere, but it's just a little, it doesn't have a drug name on it at all, right? It's just a GoodRx card. It is not specific enough for that pharmacist to really help you. And if you look here, can you guys see the GoodRx where I've got the 1135? Is that showing up, I hope?
Not yet. Nope.
Oh, dear. Did it populate yet? No?
I don't know if you hit the share button down below.
Okay. So did my slides disappear?
They did.
They did. Okay. So let me go back. Okay.
There we go.
All right. That's it? Okay, good. So, and I know this is a little tricky to see you guys, but imagine you're the pharmacy tech person behind the counter and somebody walks up to you with a GoodRx card and says, I want to use this for my drug. you're not really giving specific information to that tech. But if you have gone on the GoodRx website or downloaded it to your phone, and now you show up with these numbers that are like the magic number, in this case for doxycycline Hyclet, see where it says member ID down there on the very bottom? Like all those numbers are the same until you go across to member ID, and then they start changing. And this is where you are literally saying, I have a prescription for doxycycline. My insurance doesn't cover it. I found this GoodRx card. Here it is. Here it is. Here are those magic numbers. Can you put that in my file so that when I get to the pharmacy at Costco, I'm going to pay $11.35 rather than $22 or whatever it was. So it is not realistic when the pharmacy line is always 6, 7, 10 people deep to show up at the counter with a card that says, I have this card, can I use it? There's no research there. There's no information. So from the tech side, if they have a lot of time and they're nice, they might do the research for you. But hopefully you can understand that. See how down at the bottom on GoodRx, text this card to me, email it to me, print it to me. It's like walking up with your $5 off coupon. That barcode, everything is ready for them to put into the system. That's the easiest way to use a copay card, or again, it's hard, a savings card, so that it's practical and it's easy for the person doing the processing to give you that price. Does that make sense?
Yep.
Okay. Next.
Next question. Do the savings card prices change monthly, or is the price reliable over time?
Oh my goodness, that's a great question. That is a great question, and I wish that I could answer it. What I have seen, relatively speaking, and again, maybe I'm going to go, can you guys, oh, that's not a good one. Let's go to this one. So can you guys see my slides again? Because this has got, okay. So if you go to Big Y and you've got this single care card there to the right, a Big Y that says, you know, here's my single care for $7.84. Well, arguably they want you to sign up for that. It's really $10.84. You know, might it be $8.25? You know what? It might be. I mean, there are so many, it's way above my pay grade. All of this stuff is algorithmically based. And I'm sure data is being fed in as to what costs are and what negotiations are going on the back end. I would say, relatively speaking, I don't think you'd get to Big Y with this card and they would say, oh, sorry, it's $20. I think it would be in the range. Would it be exact? I don't know.
Okay. And how about mail order? Is that reliable?
Mail order is also a great question. So I know from being in the industry that a lot of people are dictated to use mail order for their chronic medications. Like the big one is Express Scripts. Okay. So that's using your pharmacy benefit. If you've got a mail order pharmacy that is embedded in your prescription plan, you are using your prescription plan for that benefit. They are not going to recognize any kind of savings card, even any kind of branded copay card. But whoever asked this question, I'm glad you asked this question, because if you get, for example, maybe you get your Eliquis through mail order and you have commercial insurance, you're still working, you've got what I would call standard traditional commercial insurance. If you go on the Eliquis website and find that branded copay card and read the little tiny print, there is likely a place for you to save your receipts from your mail order pharmacy, old school mail them in to some website or maybe upload it. I don't know, because every drug is going to be different. And you could potentially get a check in the mail for the balance for whatever that copay say benefit is from that branded manufacturer. So don't think that just because you have to use mail order for branded medications, that there's not a way, if you have commercial insurance, to actually reap some of that benefit. You just have to do a lot of that work because they are not going to input that for you they won't do it. They will not do it. As far as I know today.
All right. And GoodRx cards, are they specific drug only?
They are GoodRx cards, single care cards. What I call these general savings cards are bypassing traditional insurance. And the only way to really find out the pricing of your medication and compare it to what you're paying for out of pocket is to go on the internet or download. I like to download these on my phone. I have the apps right on my phone. So, Rick, if you were to say to me, Tricia, how much is a atorvastatin, right? So I would say, well, let me look. All right, well, here we go. I found your medication this is Single Care for $7.84. But oh, wait, if I go look at WellCare, I can find it for this. Again, the savings cards are best, in my opinion, if you are paying. I've just seen people with a atorvastatin, which is I've seen people with their prescription insurance plans paying like up to $35 or $40 a month.
Hmm.
Well, I'm not sure I would want to do that. I might want to not use my prescription benefit. I might want to pay $8 and not use my plan. But it involves doing research. And again, the savings cards, think about it from the pharmacy tech processing. And I had this verified by a very kind pharmacist who sat in on one of my things and said, we're likely to use it. Or we might say, I've had people at a senior center say, well, I walked up with the GoodRx card and they told me that they couldn't use it. Well, they couldn't use it because they were asking to use it for what? Which drug? Which medication? Which dose? You haven't, and the person was busy and didn't have time because there were 20 people in line.
Yeah.
That's the tricky part, I think, for people understanding about the savings cards. It really behooves the patient or the person to research beforehand rather than because, you could do this all day long. Well, can you check it for Single Care? Is it cheaper on Single Care? Oh, maybe I want to check it on, but they're not going to do that for you.
Okay. And in that same vein, once you use that GoodRx card, do you have to show it again for every refill, or will the pharmacy have it in their system?
I believe they'll keep it in the system with those codes that are now at the bottom that are registered for that particular medication. Now, if you had a new medication, let's say, now you're getting prescribed, I don't know, whatever. If you have a new medication, you would want to look at the pricing for GoodRx or Single Care or whatever with that new medication and bring in the new medication, because it is tied to what's the pricing for that drug, for that medication. Did I answer that?
You did.
Okay.
I think so. Well, the other questions kind of were the same as this, so I think we're good with the questions. We want to pull up a polling question, and if you could just leave your slides up and put your contact info, because my head is already spinning with all this different stuff. So if people have questions, they can reach out to you and you can sort it out for them. Yeah, that's great.
Okay, thank you.
So Andrew, do you have those polling questions?
I do. So I'm going to launch that now. All right. And those should have just came through on your side. I don't think the host received it, but any of the current participants should now see those webinar polls popping up. And yeah, these results are coming in now. So we'll forward these results back over your way after the webinar, Tricia.
Okay, great. Thank you. I want to thank everybody for coming. I get pretty passionate about this topic because in my view, there are ways to save, but I know it can be very confusing. So I try and bucket it in a way that people can hopefully understand the different options that are open to them. So
Thank you so much. And thank everybody for joining us. Any questions, reach out to Tricia on the drug side. Any questions to do with your finances, feel free to reach out to us, and we're happy to help you as well. So
all right.
thanks.
Thanks, everybody.